Everyone, I'm Rich. I work for GAIN. We work with people with GBS, CIDP, and other inflammatory neuropathies, offering support, carrying out research, funding research, and raising awareness about these life-changing conditions. At the minute, it's awareness, GBS CIDP Awareness Month, May in 2024, when we're recording this. And I'm joined by Claire Shaw. Hello, Claire.
Hello, Rich. Hello, people.
Today we're going to be talking all about emotional health and support that's around it. And like I say, I'm joined by Claire. I'm going to introduce her. Claire's a qualified counsellor specialising in person-centred counselling. She's based in London, in England, and she works with a GP practice, a doctor's surgery, as well as with private clients. She's a member of the BACP, that's the British Association for Counselling and Psychotherapy, which means she's proper legit. She specialises in bereavement, in gender and diversity, and in illness and disability. So she knows all about this subject. But most importantly, Claire's also got lived experience of CIDP, and hopefully she'll be happy to talk to us all about her experience and her thoughts around emotional health. Hello, Claire.
Hi. Well, gosh, I've never been introduced in such glowing terms before. It's quite funny to hear myself presented in that way. Thank you.
Well, I think the other thing that I didn't mention in that is that Claire's also a top person. She's an absolute superstar. She's been supporting lots of people, as well as me, understanding some of around my journey around understanding GBS and CIDP as well. So it's brilliant to have you here. We're going to talk about emotional health and support. But can you tell me, what do you think the emotional impact of GBS and CIDP actually is?
Yeah, absolutely. Well, I want to say before I start that I'm really going to be talking about my own experience because it's different for all of us. And even people with the same condition will have a completely different experience depending on their support network, where they are in the country, how severe the symptoms have been. All of these things make a difference. And I should also say that whilst I do have CIDP, I've got a sort of atypical form because I've got one of the little variants. So I have Neurofascin 155 or NF155 to its friends. And that means that my treatment has been different from what most CIDP patients would receive. So just to sort of flag that up. Having said that, I suspect that there are lots of things in terms of the emotional impact that we probably all share to a greater or lesser extent. And when I was thinking about this question, I was really thinking about two main aspects for my own journey with this thing. And first of all, I was really thinking about loss and grief, and not just because I'm a bereavement counsellor, but it's a real thing. I mean, just thinking about all the things, all the aspects of my old life that I have lost. Some I've regained maybe a bit, not the same amount. Some will be gone forever, and how I have kind of worked my way through the process of grieving those things. And then second aspect, again, out of my own experience and something that took me quite a long time to really recognize and acknowledge, is how traumatic this has been. So I was diagnosed 4.5 years ago. Just over 5 years ago, I was fit, active, healthy, didn't think anything was going on. And 6 months later, I was tetraplegic, admitted to hospital, and I went into hospital and I stayed in for 10 months. So it's, you know, a sort of understanding the impact of that experience on my own mental health, my own emotional health has been, yeah, that's been its own process, actually.
And there's a lot to unpack there, isn't there? I mean, that whole kind of level of trauma that's associated with these conditions. I mean, I speak to quite a few folk, obviously as part of my role with GAIN, who have been impacted by these conditions, and I think the common line all the way through everyone's journey has been the amount of trauma, whether it's recognised or not, that these conditions bring, whether it's the fact that you've been in hospital for a very long time, sometimes in intensive care, incredibly traumatic experience to go through. Whether you've been left with a progressive condition, whether you've been left with residuals or long-term symptoms that have changed your life and how you live it, all traumatic things to cope with. And that you've expressed it brilliantly there, that amount of loss that you've gone there, from one point to another, when you don't know who you are anymore, who you are anymore. That's change. That's a difficult thing to cope with, isn't it?
No, absolutely. And it's so kind of multifaceted. I was thinking about all the ways that I've lost parts of myself, and not just like physical ability, but it comes down to how independent I can be. I used to buzz around without any cares or thoughts, or really taking myself for granted, my body for granted, my health for granted. I was thinking in terms of relationships, like it's been quite shocking to me that some relationships that I thought were really solid have changed. Some have gone completely. Other people have stepped up in a way that I couldn't possibly have imagined, which has been the flip side, which is just like the win in that. I was halfway through my degree course to qualify to become a counsellor when I got ill, and I had to defer for 2 years. And just like I remember being in the neuro rehab and working with a speech and language therapist, because I couldn't swallow properly, I couldn't speak properly, I didn't have a reliable voice. It would just come and go. And I was saying, like, how am I going to be able to work with clients if I can't rely on actually being able to speak when I open my mouth? So, thinking about how my career might work out, I used to see clients face to face. Now I work online and on the phone because I'm disabled, because it's easier for me, it's safer for me, all these things. And then I also think something maybe we don't kind of talk about is financial. It's expensive being disabled. It's expensive having a chronic illness. So, there's that. I don't have anything like.
And that links into the loss as well. I've spoken to a number of people who've lost their income. They haven't been able to go back to work, and they have to rely on the welfare state, or on savings, or just on nothing. And that level of loss of who you are. I don't know about anyone else, but I'm really tied up to who my job and my role is. But it is a core part of who I am. If I was to lose that, I'd lose a big chunk of myself. And I think we take that for granted quite a lot within systems, and it's quite easy to just say, oh well, you can't work anymore. But what does that mean for you? What does that mean for you? Not just financially, but emotionally as well. We tend to get tied up within those things. So it's quite a significant change and emotional impact. But one of the things I wanted to talk about was kind of we're very good at talking about physical impact. You used the word disability just now. Of using the word disabled, and the system, the state, the NHS and how we work is very built around physical health, incredibly built around physical health. So they're very good at saving lives. They're very good at patching people up. They're very good at getting people home, often too early, but they still get people home. So that physical system is well built and well maintained, but that emotional and that mental health system, in my view, probably isn't so much. built in the right way. Do you think we've got the balance between physical and emotional health right? Or is that a very loaded question?
It's a very loaded question. No, I don't. I think you're right. I think that the doctors and the NHS largely focus on what I guess is or appears to be like the most pressing need. And they have these amazing sort of multidisciplinary teams, but somehow the emotional support doesn't really get connected up in the way that everything else for physical need does. At least that's been my experience. So I was in hospital for 6 months, and I was in the wards, and there's no privacy, and that like there was allegedly neuropsychologist available, but there's no, you couldn't have a chat with somebody. There was no regular support. I think somebody swung by once in like the 6 months and like, oh, do you want to have a chat? I'm there with like pretending that the blue curtains of doom actually screen off what you're talking about, and it's a safe private space. But that was it. And then then I went into the neuro rehab, in the initial neuro rehab, and I was offered basically CBT therapy, cognitive behavioral therapy, which is fine. I don't have any truck with CBT. Genuinely, I think it's great for some things, for some people at some times. I think if you're talking to somebody who has pretty much lost their whole sense of self, that something more maybe person-centered, a talking therapy where you can actually say, I am feeling like this, and that's like allowed, because that the CBT that I was offered, they literally said to me, oh, the first thing we want you to do is promise that you'll only be anxious for 10 minutes a day. Sure, that could happen. It just didn't really fit with where I was and what I needed. I needed to be able to express. Well, anyway, so no, I think there's a big gap there, and I think that people would probably respond. I think it's all joined up: emotional health, physical health, and if your emotional well-being is being looked after, that you're better able to cope physically, and vice versa.
And I think you hit it right on the head when you said about those multidisciplinary teams that are there to kind of build around your care and support. That you've got at the point of crisis, is probably not thinking at a point of crisis emotional health is an important issue. It's going to fix you up. It's going to keep you alive. But that doesn't mean you shouldn't be thinking about that. And then particularly after you've left acute care, that hospital setting, that's when things tend to get a little bit more emotionally involved. And we're not talking about severe mental health challenges here. That's a very different matter. And there are systems in place for that. But that lower level, I guess, emotional health, that stuff about rebuilding who you are and understanding, going through that journey and understanding what it means and how you're going to now live the rest of your life is the real key bit that's missing. And we don't have systems in place that support that. So you're right, is that there is some services out there. We have Step to Change through the NHS, which is normally a CBT program that's offered to people, 6 sessions. And for some people, brilliant, great, it really does a job. But that's if you're offered it. If it isn't waiting for up to a year, maybe more, to access it. And then what do we do around much more in-depth stuff? Well, it's not available. It just isn't available on the NHS. There isn't any service there. So it's then down to people knowing that they need it, knowing how to get it, finding it, paying for it a lot of the time. And these are really difficult things. Our system isn't set up to deal with that level. And I was having a discussion with colleagues in GBS CIDP Foundation International, the American organisation, who within most of the systems over there, whilst it's very differently funded and very differently set up, emotional support is part of the ongoing support, whilst they couldn't understand that it wasn't part of the NHS. So it's very interesting to do it. Now, you know, maybe I'm completely wrong, but I haven't seen examples of that emotional health bit working. And I'm not quite sure what it should look like. What do you think it could be or it should be? What is that offer? What should it or could it be?
My dream would be that, you know, that we would be able to access free psychological therapy, ideally for as long as we felt we needed it. Okay, I'm like really dreaming now. But even so, let's say 12 sessions of therapy where you can, you can really feel safe and secure to talk about your feelings, your grief, your anger, your disappointment, your frustrations, all of these things. Ideally, if we're idealizing it, without having to wait too long.
Mm.
And also because as we process what's happened to us, our thoughts change, our feelings change. Maybe that you might want 12 sessions every year for 5 years while you get your head around this massive life-changing thing that's happened to you. That it's not just a one-time thing. I need more help. Yeah, that would be, wow, that's the dream. Doesn't sound much, actually, does it?
And you know, even small practical steps like healthcare professionals pointing people towards or recognizing emotional health needs and pointing people towards where they can get support. I imagine there's bits of that happening, but I don't think it's universal. When it's done. Now, I don't hide the fact that I think emotional health is a really important issue, and I certainly, since I've been in this role since January, I've picked up that it's something that we as a whole, as a nation, should be looking more at, particularly across, you know, from where I'm looking, GBS and CIDP and other related conditions. Now, what I don't want to do is I don't want to sit there and commit to going, oh, we could do that. We could fund that. Claire, you've come up with this brilliant idea. We could fund that because we probably couldn't. But that's not to say we shouldn't look at this. And now it's not the position of a charity to fill the gap of the state. It's in fact, it's the direct opposite of that. We should be meeting the needs that fall outside of that. But if there isn't something available and there's no way it's going to be, and we think it should be, you know, it's not looking at, and I know we've had a discussion previously, and you're hopefully going to support us in looking at what that looks like. So, guys, bit of a spoiler alert. Watch this space. We're working on maybe not that utopia, but something along the lines to support. But in the meantime, because we're not there yet, we're not there. We're not ready. We need to look at a lot of things yet. But in the meantime, Claire, you're an expert. You're my expert in this.
Oh dear.
What coping strategies or tips, if that's not too blasé a term, what coping strategies are there that people could use to kind of help them with their emotional health at the minute if they're concerned?
Yeah. Well, I'm talking in sort of two ways. First of all, as a therapist, but secondly, as someone who's had to reach out for support. So what has worked for me has been finding my tribe, finding my people, finding my support. So whether that's been my own sort of intrinsic support network, my family, friends, colleagues who are able to talk to me about how it is for me, what's going on. Sometimes, as I said, when I was talking about losing relationships, that's not always possible. Sometimes people don't know how to respond, or they have their own kind of agenda connected to your illness, and it's hard for them to kind of give you the support you need. So then maybe if you've got a sympathetic GP, I would even speak to them, ask what's available to me. What can you recommend locally? I feel like I'm kind of a cheerleader for GAIN at the moment, but
Please be so.
please cheerlead away. But I have received a huge amount of information and support from the charity, but also through the Facebook group particularly. I feel, in my own experience, that's been an amazing resource to be able to share experience with people who get it, people who've been there, know what it's like. And also then, as I've kind of coming through, to be able to share my experience with people, it's just made me feel more like myself again, and not so sort of helpless. So those things have been really useful for me. I think it's really valuable, if you can, to try to cut yourself some slack, to just be a bit more compassionate. I've had times where I've been extremely unfriendly towards my own body, and I've been like, you jerk, why are you not working? Why, just come on, it's not much to ask, do this, do this. Self-compassion. If you are able to find a way to understand that you're doing your best in really, really challenging circumstances, and that your body is really trying to kind of survive. So yeah, try and cut yourself some slack if you can. Something else that comes into that, and I've been trying to find a better term than internalized ableism. Unfortunately, I'm not sure that there is one. So what I mean by this is, and again, I'm going to talk about my own experience, but I noticed that I'm like super hard on myself. Like, oh, I'm not that disabled. I'm not that ill. From the person who was tetraplegic in hospital. Oh, I'm not that ill, she said. I was really ill. Like, I was really, really ill. But I kept diminishing my own experience. I kept telling myself, oh, if I just try harder, I can get better. And it just putting the onus on myself, like, but actually, I was ill. I remain ill. I've been disabled by my disease, and I just have to kind of own that and live within those parameters, and not kind of beat myself up as much. It's really difficult, because I think that we kind of taught to do that. We're taught to do that early on.
Absolutely.
It's just a scratch. It's just a scratch. Don't make a fuss.
British stiff upper lip. It's a cultural
Completely.
thing that we all have to fight through and be fine and keep smiling. No nonsense.
Yeah.
Out and talk to people.
Yeah.
Those circles of support around you are really important. If you don't have that,
Mm.
like say, find your tribe, find where those people are, and that might be online, you know. And I'd always advise be wary online.
Yeah.
It's not always the safest place. It's not always the most welcoming, but there's often very good places there. And our Facebook group, whilst you know there may be things on there sometimes that we don't always agree with, you know, there are 4,000 people there who've gone through the same experience as you. That's really important in order to be able to go on there and learn from each other and support each other. And what I've found since I've been with this organisation is that the GBS CIDP community is amazing. It's absolutely amazing. It's so supportive. It looks after its own. Everyone's happy to share. It's amazing. What a beneficial group of self-beneficial group of people who are there to support each other. So if you are needing a bit of a lift, if you are needing some support, reach out to those people wherever you can find them, whether they're on one of our Zoom calls, whether they're on the Facebook group, whether they're on someone else's Facebook group, whether on someone else's Zoom meeting. I don't mind. Just find that group of people and talk to them. That's a great way of kind of mitigating, beating some of those issues that you're facing on a day-to-day basis. Just talking, sharing, really important. Am I being too kind of broad there? You know, for me, you know, getting that information shared is really important, because someone else can go, yeah, that's happened to me. Oh, I know what you're talking about. I've been there. Or
Yeah,
try this. You know, giving you some support. It's great.
yeah.
We you know, we've talked about, you know, that kind of emotional support, and your strategies and tips, but what should people do if it's really bad? We're talking about
Mm,
crisis. I mean, you're having a proper either emotional health or mental health crisis. What should people be doing then?
yeah, absolutely. And it's really important that we talk about these things, and that we don't shy away from the fact that
Nothing wrong with it. It happens to all of us.
absolutely. I mean, I've had my own brushes with this, and so I think the most important thing to remember is that there is help out there. So, and depending on your crisis level, um, if you're just feeling a bit overwhelmed and starting to feel low, but it's not crisis, I would say please speak to your GP. If you have access to your neurologist, if you're concerned they might be able to help you with something physical that will alleviate some of the anxiety that you're feeling. If things escalate, you can speak to the Samaritans 24 hours a day, 365 days a year. They are always there. There's always someone you can speak to. And they're really good. And then if you're unable to do these things, you can call 999. You can get an ambulance, or you can get someone to take you to A&E and say, I'm in a crisis, I'm in an emotional crisis, and I need help. That's what I would say.
If it's not as significant as having a full acute crisis, there are lots of other ways you can reach out to people as well. You know, I will say, Gain are here. You know, we're you know, not in an emergency. If it's an emergency,
Yeah.
as Claire said, but if you want to reach out and have a chat with somebody, myself or our Claire will be here, where, you know, to take your call if needed. If we're not available, you can leave a message and we will get back to you. We're not emotional or mental health professionals anyway, but we do understand, and we're willing to talk. So, you know, reach out to somebody. If it's not us, find someone who you can reach out to. That's brilliant, Claire. Thank you so much for that. Before I let you go, I've got one more question for you. Right, there's been an election. The new GBS CIDP party has been elected. I'm obviously Prime Minister, obviously. But I'm choosing my cabinet and my new Secretary for Health and Social Care. Claire Shaw, you're welcome to the cabinet. What are you going to put in place around emotional support? You kind of alluded to it earlier, but what would you do? I'm giving you the magic wand. What would you do?
Give me the purse strings. Let's see an investment.
I've got to talk to the Treasury about that. All
Yeah,
right.
I'm afraid so. But yes, appoint them wisely as well, please. But that's it. I think there needs to be an investment in social care, in mental health provision, just touching even outside of our very specific niche for other chronic illnesses. And I'm thinking of the upswing cases of long COVID, for example, where people are not getting supported. So we really need to see more investment and provision in getting people's mental health improved. If we're looking really at a sort of societal change where mental health is valued as what am I trying to say? That works alongside people's physical health, and that's not they're not two separate things. They go alongside, and I think that's part of the MDT conversation that we had earlier. It should be part and parcel. So yeah, that would be what I would like to see. I would like to see a sort of societal swing towards supporting people better.
I mean, that's amazing. I think there's a, you know, yeah, we could get people, you know, yeah, investment is key. If we're not going to get investment, let's get people working together and doing it. But that kind of that issue around stigma and people being able to talk about emotional and mental health, I think is absolutely sensational. Sorry, did I interrupt you for one final point? Did you have?
I was just going to say, you know, it's lovely. I'm loving my new position in government and all of that. But actually, this isn't real. This hasn't yet happened. So I'm just thinking about, okay, so what can we do? What can we do as individuals now as things stand? And again, I'm speaking from my own personal perspective, but I really feel that if you have the physical and emotional capacity to get involved, that you can do something that feels productive. And even if that's joining up for research studies, doing surveys. I get the Neurological Alliance survey every couple of months, and they're a kind of lobbying group that can help potentially facilitate some change. I'm on everybody's mailing lists. So just like getting information, seeing what's out there, seeing what's going on. Oh, that looks like an interesting webinar. I'd like to attend that. Sign up for sign petitions, just anything that feels productive, proactive. And really, most importantly, for our group of people, my tribe, is continue to kind of spread awareness about the diseases, about what the symptoms are, about gain. And yeah, I just feel like if more people know and understand, we're getting somewhere. We can get some traction with that.
Claire, that's amazing. We'll finish there because I can't better that. Claire, sure, can I thank you so much for joining us? Thank you very much. You've been an absolute star. If people have got any worries or concerns around emotional health, please reach out to the right people. If we can point you towards the right people, or we can help ourselves, please get in contact with us because that's really important. But in the meantime, if you've got any views or anything on this, please let us know your thoughts around emotional health, your experiences, your stories. Please share them with us so we can share them with others. But in the meantime, thank you so much. Have a wonderful rest of your awareness month, and we'll see you again soon. Thank you.
Thanks.